Welcome, welcome, everybody. We are back. I know that this is not playing when we are recording this. However, this is our first recording after our summer break. I hope that you guys have enjoyed our summer series. It was fun reviewing some of the best webinars that we have had with Airway Circle. Thank you guys for being there. I hope you guys took advantage of the discount code we had for the summer, and you had this week my kids go back to school next week. Like, I cannot even believe we are not ready first week of August. However, we have such an incredible speaker with us today. I am so excited to introduce her to you guys. So here we go. We have Dr. Ariana Ebrahimian. She is a respected practitioner, speaker, and educator in the field of functional dentistry. She maintains a private practice in Scotts Valley, California. Ebrahimian Integrative Dentistry, where she takes an integrative root cause approach to treating orthodontic problems, sleep disorder breathing, temporomandibular joint disorders, tethered oral tissues, and chronic oral systemic inflammation. The topic today is Breathe, Grow, and Thrive, a functional, collaborative approach to early airway, tongue, and growth assessments for children ages 0 to 6. Welcome to the Airway Circle stage. We're so happy that you are here. You're welcome to share your screen and say hi to everybody.
Thank you so much. Thank you so much for inviting me. I'm really honored to be here, and it's always fun to talk with like-minded professionals.
Yes. Where's your practice close to? I am
So we're
geographically.
near Santa Cruz, California, right on the Monterey Bay, kind of like in Central California, about an hour south of San Francisco.
Oh my goodness, amazing. We have so many patients there. And this is a reminder for everybody. If you're not in the Airway Circle directory yet, please join us. It is free for practitioners to join. You just go on the Airway Circle website, you click on directory, and you click on add new. You put your own information there, and all of a sudden you are on our website and getting referrals from other professionals and from patients who go over there, look for you. Thank you.
Thank
Here we
you.
go.
All right. So I'm hoping, if you're in this space, I'm hoping that you walk away. My goal for today's presentation is that you walk away with maybe at least one thing that you hadn't thought of before. The more time I spend doing airway-centric dentistry, and the deeper I go into this, the more I'm actually amazed. My first step into this was just really about preventing sleep apnea in kids. Like, what can we do to prevent sleep apnea? My own sister, younger sister, she's a dentist now. She had traditional orthodontics just like I did. She ended up with sleep apnea and had double jaw surgery to reverse it. And that happened right as after I graduated dental school. And so it really set my career off in an entirely different trajectory than I thought it was going to go, because it just really lit this fire in me about, like, what can we do for kids so that we don't have to be here at the hospital years later having this kind of an experience. So at first it was just about preventing sleep apnea. And then the deeper I went and got really more into kind of the functional medicine side of things and functional dentistry, it just really started to open up, like, all of these other reasons this is so, so critical, especially at the very, very beginning of life. So I'm going to talk today about this window from 0 to 6. What can we be doing to screen, treat, refer, and set these kids up for a really healthy, vibrant life? Okay, so we're going to talk today about why early matters. Why is it so important that we start this process actually preconception, but definitely from birth? We're going to talk about what to screen and why. We're going to look at a few case studies of cases that I've treated in my own practice. We'll talk about functional screening and intervention, and then how to build your team. Because if there's one thing I hope everyone here has learned, it's that you cannot do this on your own. You have to practice with a team. And then we'll do a little Q&A. Okay, so why early matters? You guys, I'm sure, have heard this slogan by now, this hashtag fixed by 6, right? We know that 60% of the cranial growth is completed by 6 years old. And the shape of the jaws really determines the size of the airway. So as we're growing and developing, you can see over here on this photo here, just like how much has happened to the skull in 6 years. So this is 0 to 6. This is like 13 to adult. So the difference between 6 years old and the adult not really as dramatic as 0 to 6. So there is a lot happening here in this window. The structure is influenced by the function, right? So how we're breathing, how we're swallowing, our tongue posture, the muscle tone, that's influencing the way the face is actually growing. And then our structure, in some ways, kind of determines our destiny. So the earlier we intervene, the more we can guide this growth to be proactive instead of reactive. The Breathe Institute put together this great graphic here about a nose breather versus a mouth breather. When I first started practicing airway dentistry almost 18 years ago, this was kind of novel. And I was talking to patients about it, like not a lot of, John Mew had his cases out and I got a lot of kind of blank stares, and I'm so happy I see this now all over all over the internet, all over social media. Like the general population is cluing into how your breathing is changing the way your face is actually growing. And we're gonna look beyond the face today. So airway dysfunction often looks like everything else that may be going wrong, especially in early childhood. So we have behavioral issues, right? ADD and ADHD, sleep disturbances, chronic congestion or allergies, delayed speech or feeding issues, that behavioral dysregulation, poor school performance. These kids often get labeled wild or crazy, hard to focus, they're not doing well, when in reality, it really is coming back to the way they breathe. A lot of these signs are misdiagnosed or overlooked. If I had a nickel for every time a pediatrician said, oh, the mouth breathing isn't that big a deal, or oh, that tongue tie doesn't look that bad, I wouldn't be practicing dentistry anymore. It's a lot. So it really does get overlooked. I made a short list actually of common diagnoses and potential root causes, right? So we talked about the behavioral stuff, but there's frequent ear infections. So kids that come in, they have tubes in their ears, they've had multiple rounds of antibiotics very early in life, which is so detrimental to the microbiome. That can really be due to like enlarged tonsils and adenoids, eustachian tube dysfunction, all again coming back to the mouth breathing. Allergic rhinitis and chronic congestion is worsened by oral mouth breathing. So it's like that chicken and egg cycle. Like, why are they mouth breathing? But also they're mouth breathing because they can't breathe through their nose. And it just kind of it perpetuates and continues to perpetuate. Speech delay and lisps, difficulty feeding or picky eating. So when we talk about screening later on, we'll talk about how important it is to really dig deeper with parents and ask, like, how did weaning onto solids go? What was that like for this child? Did they avoid certain textures? Were they very picky? Were they gagging or choking more so than would be expected as they're getting onto solids? Because that can definitely have to do with tongue tie and tethered oral tissues. Forward head posture, mouth open, right? When we mouth breathe, it throws off posture head to toe. As that head comes forward, it pulls on that whole fascial system in the body, and it affects so many things. Grinding, that actually, that's one that parents notice because they can see it on their kids' teeth, or they can hear it at night. So I get a lot of new patients come into the practice with the chief concerns like, my kid is grinding their teeth at night. Why is this happening? I don't know about you all. I was taught in dental school that kids would grow out of it. No, they grow kind of into it and around it, right? There is a root cause that just because they may not be totally obliterating their teeth once the adult teeth come in does not mean that the root cause has gone away. And then, of course, delayed growth or bedwetting issues. So now we're getting into hormonal regulation when we have fragmented sleep or poor oxygenation during sleep. So lots of different things that can pop up, but the root cause can really all come back to this airway, tongue-tied, mouth breathing thing. Okay, so in systems biology and functional medicine, we're really trying to get at the root cause of chronic diseases, and we're looking at bidirectional relationships. So I want to kind of frame the mouth as a mirror to the whole child. While I was creating this graphic, I realized that yes, the immune system and the microbiome and the airway and the nervous system, they do affect the oral cavity, and the opposite is also true, right? The oral cavity affects those systems as well. So, for example, a tongue tie, it's not just a feeding issue, right? It's a breathing issue, it's a sleep issue, it's a posture, gut-brain axis. So if we really want to take a functional approach, we can then become key players in these children's overall health. Like we can offer a lot more oftentimes, I think, than the pediatrician is offering for their quick well checks. We're seeing, especially if you're getting them in early, if I do a tongue tie on a 6-month-old, I'm starting that whole dental relationship, that airway focused relationship at 6 months. And I'm seeing this child now at every 6 months. And we're kind of building on this, like every new milestone that comes up. Okay, we dealt with the breastfeeding, that's going well. Now they're 6 months later, we're introducing solids. How's that going? Now, 6 months later, we have speech coming on board. So all of these different milestones, you get to be such a key player in this, which is really, really exciting. All right, the tongue tie and the gut-brain axis. A tongue tie, in our world, we often think of a tongue tie as just like impaired oral function, right? Poor latch, breastfeeding's not going well. We're going to go ahead and we're going to release the tongue tie, and that's going to help mom and baby, their experience, that dyad, nurse better. Look at the entire downstream effect of a tongue tie, and all of a sudden, this becomes like really profound, right? So it may start with the chief concern being impaired oral function. They're having all the symptoms of a tongue tie. They're swallowing air, they're colicky, they're reflux. It's painful for mom to be nursing, their mouth breathing, low tongue posture. But if that goes unchecked, that develops then again, that next milestone, we get feeding and breathing dysfunction, right? They're not feeding and breathing well. And that disrupts now the microbiome, the gut microbiome. It disrupts the oral microbiome for sure. And it also disrupts the gut microbiome. And the gut microbiome kind of rules the roost in the body, right? Our gut is sending out a lot of information. We have 10 times more information that goes from our gut to our brain than from our brain to our gut. So when our gut is out of balance, everything is off. Our serotonin is off. We get inflammation throughout the body. We have poor nutrient absorption. So even if you're eating like the healthiest diet you possibly could be eating, you may not actually be getting all of those micronutrients that your body needs to grow and thrive. Certainly inflammation, we know that inflammation is the root cause of so much chronic disease. They've coined that term inflammaging. This can start when you're an infant. And then as that gut gets disrupted, now we have stress on the nervous system, right? So poor sleep, certainly mouth breathing is the first step on that spectrum of sleep disordered breathing, ending with severe obstructive sleep apnea. We want to try to catch it at the beginning, right? It is a lot harder for me to manage somebody who has severe obstructive sleep apnea. We're having a very different conversation when we're at that end of the spectrum than when we are at the mouth breathing end of the spectrum. We're going to talk today about the vagus nerve, cranial nerve number 10. Take out your anatomy textbooks and remember what that nerve does and how mouth breathing disrupts that vagus nerve activity, and really leads to chronic stress throughout the whole system. You get the activation of that HPA axis, which again just keeps kind of generating the stress within the body. And then, of course, if your nervous system is under stress, that's going to manifest in several different ways. I mean, definitely mood and behavior issues. So these kids are harder to, they have a more difficult time self-regulating. They may have more anxiety. They may have more tantrums, sleep disturbances. They move around a lot. They're sweaty sleepers. We have, night terrors. There's all sorts of things going on at night. Trouble focusing, like we mentioned, ADHD, and speech and social delays. So it's all really, it may start here, but the downstream effects can be quite profound. If you're not super familiar with the gut microbiome, when it is out of balance, we call that dysbiosis. And the gut and the mouth have this bidirectional relationship. So oral dysbiosis can influence gut dysbiosis and vice versa. And here's a list of different body systems and what the effects of oral dysbiosis are, what the effects of gut dysbiosis are, and then shared outcomes. So I just want to highlight a few of these because they are far reaching and they can all come back again to this poor oral posture. So in the immune system, chronic low-grade inflammation is going to lead to eventually to autoimmune disease. I remember in our pathology classes, when we were learning about medical histories and going over everything, autoimmune was kind of like a smaller section, like, oh, and you may see some patients with autoimmune disease, and here are these, names of Hashimoto's thyroiditis, and it was like, I feel like it is now the rule, not the exception, right? Like most of my adult patients come in now with some sort of an autoimmune condition that they're dealing with. And the gut dysbiosis is a huge role in that. When we have intestinal permeability and leaky gut, we get things into our body that should be passing right through, and our immune system really, it lives in our gut. So if that gut lining is disrupted, we get pathogens through the gut lining, it activates that immune system, and the immune system then stays in chronic state of overactivation, and now we have autoimmunity. The relationship between oral dysbiosis and cardiovascular disease has been in the literature for a long time. So we all know by now, like atherosclerosis, elevated C-reactive protein, endothelial dysfunction, certainly periodontal disease has a huge role in that. But also now getting into the gut, we have increased oxidation of our LDL cholesterol and systemic inflammation. All of this is leading to increased cardiovascular risk. Metabolic system. So this is probably maybe the biggest health crisis facing Americans today is we are totally metabolically busted. I think they estimate something like over 90% of the population has insulin resistance, which is wild when you think about that. We have lost our metabolic flexibility, our ability to take in glucose and respond in a healthy way. That spectrum again starts with insulin resistance and then ends up with type 2 diabetes, non-alcoholic fatty liver disease. They're calling Alzheimer's type 3 diabetes. It has its roots in this metabolic dysfunction. And oral dysbiosis and gut dysbiosis, again, are a really big piece of that. How does what influences that? Mouth breathing. Mouth breathing can create this dysbiotic environment. And then the reproductive system. This also seems to be a kind of burgeoning crisis in our country. Infertility is a really big issue for couples these days. And so, there have been actually specific bacteria in the mouth that have been associated with infertility, poor sperm and poor egg. And then when your gut is out of balance and you get the hormone imbalance that comes with that, now we have things like PCOS, possibly endometriosis. And that whole hormonal dysregulation can lead to fertility issues. So I pause on this slide because this is what I mean when I say I started talking about, I started this work because I was so concerned about the effects of sleep apnea. And the deeper I went into it, really kind of the more terrifying it is, the more you realize like how wide reaching airway dysfunction can be. It can affect every system in the body. So let's pause too and talk about the nervous system. The great irony of doing airway interceptive orthodontics for children who have airway issues is that often the children that need this work the most are some of the most challenging to work with because of their nervous system dysregulation, right? They can't sit still in the chair, right? They're literally like spinning around the room. You've got to like get them to sit still. They don't want you in their mouth. They're very gaggy. They're kind of like there's a lot of anxiety surrounding what's going on inside their mouth. And this comes back to the relationship between the tongue function driving growth, posture, and neurology. Okay, so cranial nerve number 10 is your vagus nerve. It is your primary parasympathetic nerve. All right. So this is the rest and digest. This is what's controlling that heart rate, digestion, respiratory rate. It actually can modulate inflammation in your body. And it supports social engagement and speech, right? There is a branch of the vagus nerve, the recurrent laryngeal nerve, that innervates the palatal glossus muscle, and that's involved with swallowing. And, it's one of the only extrinsic muscles of the tongue that's innervated by the cranial nerve number 10. So, that's a big piece to it as well. When you have a tongue tie present, you get a fascial restriction, mainly from the deep front line that runs down the entire front of the body. That can actually mechanically irritate or inhibit vagal tone. your vagus nerve actually passes through the diaphragm. So when you have tension, your diaphragm is connected to that deep front line of fascia. When you have a tongue tie that's pulling and creating tension, it actually can irritate that vagus nerve. It's also going to affect oral motor coordination, right? We talked about the palatal glossus muscle, so it contributes to swallowing. And then sleep and airway issues as well through neuroendocrine dysregulation. There is this polyvagal theory. I don't know how many of you are familiar with the polyvagal theory of the nervous system. So it reframes. We were all taught about the autonomic nervous system being two branches: the sympathetic nervous system, your fight or flight, and your parasympathetic nervous system, your rest and digest. But the polyvagal theory kind of reframes this into a three-tiered hierarchy that really is like emphasizing co-regulation, social connection, and safety in order to help children grow and thrive. So these three different hierarchies are the ventral vagal complex. So that's the topmost one that's responsible for social engagement. So it's in terms of evolution, it's the most recent. It's the cranial nerve number 10, and that makes you feel, when you're in a ventral vagal state, you feel safe. You feel calm. You can absorb information, right? You can have your mouth worked on and not be in a state of sympathetic overdrive, right? The next level down is your sympathetic nervous system. So this is, your spinal nerves. This is that fight or flight. You're hypervigilant. We know our patients that are stuck in this sympathetic overdrive, right? Their system is in a chronic state of stress. These are our patients that collapse into autoimmune conditions because their body just can't handle it anymore. And we know that mouth breathing kind of creates that sympathetic state. And then the last one is the dorsal vagal complex. So this is the most primitive. This is like you freeze, right? You freeze or you collapse, you dissociate, you shut down. So people who experience, extreme trauma in their life, they're in that dorsal vagal state. And it can sometimes be difficult to move from that dorsal vagal state upwards towards ventral vagal, right? And there are different techniques. If you want to kind of do more of a deep dive into that, I don't have the time to do it today, but there are different techniques to help move from that dorsal vagal state upwards towards ventral vagal. Interestingly enough, humming is actually one of them. Humming kind of like soothes that vagus nerve. And whenever I'm doing my tongue tie releases on children and adults, actually, but somebody who's, verbal, I have a pulse ox on them. And when I see that pulse start to rise and I know they're moving into, that sympathetic or dorsal vagal state, we do a lot of humming in the middle of the procedure. We'll put everything down and we'll hum together and we'll just kind of try to get back into that ventral vagal state. So the ventral vagal allows us to make eye contact. It allows us to modulate the tone of our voice and the pitch of our voice, to express our emotions, to hear human speech, like to middle ear tune. When there's other noise around, it allows us to pick that out. It allows us to feel connected and regulated in social settings. So you can imagine if you have a dysfunction in the system, that can be seen in children or adults that are on have autism spectrum disorder, they experience anxiety, trauma, or tongue tie due to its impact on all of that, on facial and oral tone and vagal feedback. So again, nervous system, this is a big piece of the tongue tie airway kind of flow here. In our world, the dental and airway relevance. So if we have oral motor issues, so if we have a tongue tie that is preventing us from using our tongue and posturing our tongue in the way it should, it can interfere with that vagal feedback, thereby interfering with social engagement. It can, if we improve our nasal breathing, if we do the myofunctional therapy, if we do the tongue tie release, it can have a positive effect, right? It could support vagal tone and autonomic regulation. I mean, if you guys are doing myofunctional therapy and you're doing nasal breathing exercises, you can see this in the course of 5 minutes. I mean, when I have a kid in the operatory for our initial visit and they cannot sit still and cannot focus, and the parent is trying so hard to listen to what I'm saying, we do a lip taping exercise, as long as their nose is open. We have the X-Clear in the office. We do a lip taping exercise right then and there. I put a timer up on the monitor, and there's a sticker in it for you if you can sit there taped for 1 minute, and there's two stickers in it if you can sit there taped for 5 minutes. And it has the the dual benefit of, one, not only helping to calm the child so that the parent can pay attention to, the consultation, but also to kind of proving that, like, it's a really quick, easy way to prove that, hey, when you shift the way you breathe, you shift your nervous system, you get into that ventral vagal space. So if you have your patient, if you're doing general dentistry and you have a patient that is struggling with procedures, gag reflex, anxiety, sensory integration, this is something to pay attention to, right? It could maybe coming back to their airway. All right, so what are we screening and why are we screening for it? So in my practice, airway is first. It is the foundation of growth and function. The things I used to get so fired up about at the beginning of my career, occlusal philosophies and whether we should be putting amalgam or composite. That seems like a very easy one. But the traditional kind of like fights in dentistry over the years seems so silly to me when you reframe it as like, is your patient breathing or are they not breathing? Because that is foundational to everything. If the patient isn't breathing, like, does any of the rest of it even matter? I mean, if they can't breathe right, they can't grow right, right? So airway patency, it influences their oxygenation, their sleep quality, and their facial growth. We know this. We know that in children, these issues are often silent, right? If they've never known any different their whole life, I mean, how many kids come in and say, like, I can't breathe? Like, that's their normal, right? And adults who grew up that way, that's their normal too. If were somebody who releases tongue ties on adults, that sometimes they can have a very profound change, and they will say things like, oh my gosh, like, this is what it feels like to take a deep breath, or like, this is what it feels like to have that tension gone in my neck and my shoulders. Like, they don't know any different. So the most obvious signs: mouth breathing, open lip postures, snoring or noisy breathing, restless sleep, poor focus. I feel like these common signs, usually, if you have a parent who's educated, these are the kind of signs that they'll notice and may come to you like with these concerns. Like, hey, I've noticed this in my child. My baby sleeps with their mouth open like that. I've learned that that's not normal. What should it be? What's contributing to that? And then we look inside and we say, okay, yeah, there's some restricted frena here, right? We've got tongue tie, and that can look many different ways. And then we have to educate about the fact that just because it looks a certain way doesn't mean it's functioning correctly, right? Like, how many times have you had a patient say to you or a mom say to you, like, well, they said there was a tongue tie present, but that it wasn't that big a deal. Or they said that there wasn't a tongue tie present, but I'm having like all of these issues with feeding, right? So we know that in infants, kind of unfortunately, because it causes us to do a lot of explaining, that how a frenum looks doesn't necessarily correlate to the symptoms a mother and an infant are experiencing when breastfeeding. Facial growth. So what is the face telling us, right? When you start to clue in to how oral posture changes the way a face grows, you can pick these people out of the crowd, right? You're waiting at your gate at the airport. Your airport terminal is my favorite place to watch profiles and look at people's oral posture, because everybody's kind of zoning out on their phone or looking out the window, and you can just see it. Like, you can see the people who should be carrying a CPAP for sure. You can see the children who are not sleeping well, or you can probably spot the teenagers who have braces on just by looking at the outside of their face. So facial and jaw growth is absolutely function driven. And when malocclusion is often the first sign of dysfunction, I am really working on trying to educate my colleagues that, don't wait until you see this. Okay. This is already too late. We're too late. You should have seen this coming a mile away when they were in their baby teeth, when there was guaranteed no spacing between the primary teeth. The primary teeth may have even been crowded. And so, don't just note the crowding. Don't just note that, there's no space between the baby teeth. Like, why? Why is that happening? And what can we do right now at this moment to redirect this and get this back on track? Because this already is kind of challenging. Like I ended up making space for these teeth, but that was challenging. It would have been a lot easier if we had started 3 years earlier.
Lies, lies, and more lies, and lies on top of lies.
So those who say tongue tie isn't real are lying. Um, you have to do a functional assessment. So you saw that video. She has her finger inside the baby's mouth and she's getting that baby to actually try to suck on her finger and then pulling down on the chin to see what is the tongue actually doing. Don't listen to the doctor or the lactation consultant or whoever that said like, well, they can stick their tongue out, so I think it should be fine. No. You have to actually do a functional assessment. I want to look at lip seal and nasal breathing and behavior at all ages, behavior at all ages, tongue and lip mobility, compensation patterns. My training was with Dr. Zaghi at the Breathe Institute. So we're looking at things like floor of mouth compensation and are they engaging their neck muscles? We're looking at their lymphatic tissue, their orthodontic screening, sleep and behavior quality, their birth history. I cannot stress how important this is if you are treating in that 0 to 6 window. It's not just your breastfeeding babies that you need to take a birth history on. You need to take a birth history really on every child you see, like a detailed birth history. There are so many clues hiding in that history about what might be going on for that child. So you really want to dig deeper. The feeding history, breastfeeding, bottle feeding, weaning onto solids, habits, pacifier, digit sucking, blanket sucking, shirt chewing, all of that. So are there sensory issues, behavioral issues, speech issues? I've created a functional screening form for you all, and there'll be a link at the end to a QR code so you can grab this and download it and hopefully use it in your practice, and kind of goes through some of these are the questions I ask every day at my practice, right? So it starts with that birth history when we talk about it. Was your child born premature? Or full term? Was it C-section versus vaginal? Was there forceps or vacuum used? Was it a traumatic, was there something particularly traumatic about it? And then of course, getting into the feeding issues, was there any difficulty feeding or latching, chronic mouth breathing? Is there snoring or grinding of the teeth or waking frequently? History of reflux. So this is not every question we ask, but it is kind of like the broad, it's hitting the high point, so to speak, that should start to help you uncover what might be going on. Some of them may seem not as obvious. So like eczema, asthma, or frequent illness. So these are the kinds of questions that are cluing me into gut dysbiosis. So now I'm looking to see like, how is this connected? Because if we have a dysbiotic gut, we know the immune system is compromised. They are going to be potentially more allergic child. Multiple ear infections or tubes in the ears, history of antibiotic use. I like to know how many rounds they've had. Sometimes I'm seeing kids who've had like 5 rounds of antibiotics in 5 years. That has wiped out their microbiome, right? They are starting with a very dysbiotic environment. And so, whether it's yourself or really working with kind of like a functional medicine practitioner to help to rebuild that is getting at the root cause. You can do like all the myofunctional therapy in the world and the tongue tie and the ortho, but like if ultimately they just have a really overactive allergic response and they can't breathe through their nose, it's very difficult to keep that stable and really get at the root cause. So speech delay or articulation issues, have they seen a body worker? Body work is so important. Have they done craniosacral or chiropractics? Have they seen a cranial osteopath? I want to know, who have they seen? How many times did they go? Why did they go? What kind of improvements did they see? And then we get actually into the clinical exam, right? So now we're looking at all the things that you guys probably are already looking at, right? How does their palate look? Lip seal, mentalis strain? What does their occlusion look like? Have any open bites or cross bites, lymphatic tissues, or wear on the teeth? And then a little section at the end where you can start to think about who's on your team, start fostering those relationships, and where can you, where do you need help? Where do you need to reach out and get this patient, in the right lane? Okay, so some case studies here. I picked 3 different ones. So we'll start with Johnny. This was a tongue tie case. He had mom's chief concern was tongue tie and an underbite was developing. So I think he was like when I saw him, he was almost 3 years old. It was the first time I saw him. There was a history of heavy breathing, mouth breathing at night, occasional snoring and choking while sleeping. He was missing the first syllables of words. It was very difficult to understand him, practically unintelligible. There had been some respiratory issues that actually required ER visits and steroid treatment, and he had had a previous release and it was incomplete, right? So you can see there's kind of like this band of scar tissue right here. And this was him doing his best, elevating his tongue kind of like in a cave position, and this was him trying to get the tip of the tongue up. He was born full term. However, he was born via C-section, which creates some cranial strain issues. And he was breastfed for 2 years, amazingly. And the pediatric dentist had noted an underbite, but recommended monitoring. Please don't monitor. Please don't watch a child continue at 2 years old, continue to suffer like this. Just like make the referral. If you don't have the skill set, don't let your ego or your lack of knowledge get in the way. Like just make a referral to somebody who may know better.
Watch what happens when I release a tongue tie on a 3-year-old. He had issues from a baby, from his breathing, his sleep, his inability to eat. And it had to do with his tongue tie. And so I came in and Dr. Ariana assessed his tongue tie, and we were referred to speech therapy to help him to learn how to do the stretches and to learn how to move his mouth. So we came back to Dr. Ariana to perform his procedure, and she released his tongue and his upper lip tie. It was done in the most graceful way. As a nervous mom, she was able to keep my son extremely calm, and I think for something that is probably more traumatic for a parent than even the child, it was done in a kind, her office did everything in a kind, gentle way. I have already seen huge improvements in his sleep, his ability to eat and move his tongue around effectively to move food in his mouth. And he, in 1 week, has already learned sounds with his speech that he was unable to make before. So it's been the best thing that we could possibly have ever done.
All right, so this is post-op. This is taken a week later after his release. This was not easy, 3-year-old awake. But like those are the cases you absolutely say yes to, right? I mean, this made such a profound change for Johnny. Okay, so Zoe, mom's chief concern with Zoe was, does Zoe have an airway issue? That was the chief concern. So she had dark circles under her eyes. She'd been snoring since birth. There was a tendency for ear infections, sinus congestion, mouth breathing, headaches every 2 weeks. She was getting headaches every 2 weeks, and she had a stuffy nose. And she is like, I think 6 years old. She was born full term via vaginal delivery. There was trauma due to pushing too early. She was breastfed with difficulty at first, but mom persevered until 18 months. And then she also had a pacifier until age 2. She is congenitally missing tooth letter D, which is an upper lateral here. Okay. That's her, those are her teeth beforehand. So you can see she's like basically edge to edge, almost an underbite here, and not a lot of spacing going on. That's her airway. Okay. So hypertrophy, there's her tonsils. There are her adenoids touching. Okay. Basically touching. She had a grade 3 labial frenum. Her lips were apart all the time, mouth breathing. Her lingual frenum actually was okay, but she did have a pretty significant anterior thrust. So we referred her for myofunctional therapy. We talked about dairy and gluten elimination diet to see if those were any potential triggers for this airway congestion. I recommended an air purifier in the bedroom, daily nasal hygiene, probiotics. that are actually designed for the throat and nose and upper and lower expansion. So she went off to the myofunctional therapist. I also, after getting the CBCT back, I referred her to ENT because those are really massive. And I know that everyone involved here is going to have a really difficult time if we don't clear out that nasal airway. So here's the report back. By the time they actually got into Stanford to have the lymphatic tissue evaluated, she's already 3 months into treatment. Like, we didn't wait getting started. We just got started. She got her evaluation. And ultimately what the ENT said was that she came because she was having severe headaches that were so bad she was staying home from school. She saw many providers as part of the workup and ultimately saw an airway dentist who noted the snoring and mouth breathing symptoms. She since has had her expanders in. She has loud snoring most nights. Snoring has improved with the palatal expanders, mouth breathing day and night, no pauses in her breathing, no gasping, choking, or coughing, blah, 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 blah. The radiology films were reviewed, and yes, there is notable hypertrophy. The tonsils are somewhat enlarged. The recommendations were that ultimately the ENT said to the mom, the expanders have significantly improved both her sleep and her headache symptoms. They can see notable patency of the nasal cavities. The recommendation was continue the expanders for now, and mom will reach out if snoring or sleep symptoms get worse. That's just in 3 months. This was why I'm still treating this child. Like, we're still expanding, we're still doing myofunctional therapy. So it can, 3 months in can make a big difference. And the last case I'll share with you as we start to wrap up here is Emerson, who had an orthodontic and tongue tie evaluation. That was what they came in for. I think they were referred by their pediatric dentist to my practice. He was 7 years old. He was diagnosed with sleep apnea in 2020, and they had recommended a tonsillectomy, but mom didn't follow through with it. So he had mouth breathing and speech articulation issues. He was a really messy eater, excess saliva. He was born vaginally, full term, normal, no problems with breastfeeding or weaning, but you can see the open bite that's developing here. You can see the unilateral cross bite. And so here are his scans. You can see just how retrognathic that upper jaw is and what a steep mandibular plane angle he has. We recommended myofunctional therapy, upper lower expansion, and I actually did use a reverse pull headgear on him. And so here are his progress photos. And then when we were done, everything kind of settled in like this. So here's where he is now, and the sleep apnea is gone. Okay, so as we move into this last section here, so how to screen and practice. So a really detailed health interview with a parent is super important. I mean, honestly, my new patient exams are like 90 minutes long and like 30 to 45 minutes sometimes is just getting the detailed history and the photographs, because we really ask a ton of questions. All the things we talked about. One of the things I hadn't talked about yet was mold exposure. We live, in beautiful coastal area. We get fog. We have a lot of mold issues in our community. And so children who have been exposed to mycotoxins, and that can be a hidden source of nasal congestion. So if you live in areas where it gets damp and things don't always dry out, you need to be asking about mold, and you need to find somebody in your community that is testing these children for mold and helping to detox. It's not particularly difficult. It's mostly just bentonite clay, detox gently, but it can be very, very difficult to clear up the nasal congestion without knowing if that piece exists. Okay, that's a hidden piece to look at. And then your clinical exam, if you have access to a CBCT, it really, really helps. Look at the airway from like all the way down, nose down. When to refer and to whom. Okay, so if you have a tongue restriction, you're a dentist, you can't be releasing these without getting them to also do a myofunctional therapist or feeding therapist for children who are of the age where that would be appropriate, or working with a lactation consultant if they're infants. A Thai proficient lactation consultants. Not all lactation consultants have education and training in the tongue tie space. And so working with a Thai proficient lactation consultant is a huge difference than working with somebody who doesn't have that education. SLPs have a feeding therapy component to it that they can work, and OT. I have an amazing OT on my team, and couldn't do the work without her. You're looking for behavioral sleep red flags. That's going to go to a sleep MD. a pediatrician if they're savvy enough. Honestly, I never refer to a pediatrician, but sleep, ENT, airway obstruction is, you're going to need an ENT on board for that. Structural dysfunction, this is where the birth history becomes so critical, because fascial tension, torticollis, traumatic birth history, if patients can swing it, I'd love for them. My first choice is to go see a cranial osteopath, because the work they can do is magic. And then, other body workers, craniosacral, chiropractor, PT, OT may have some of that skill set too. And then certainly, once those teeth come in and you're seeing not enough space or that malocclusion developing, you want to get them to an airway focused dentist or orthodontist. It doesn't need to be doctor only. You really want to empower the whole team. Your treatment coordinator, your assistants, my assistants are the ones that are gathering the history. My hygienists are trained on what to look for. I had one hygienist retire out of my practice into full-time myofunctional therapy. So, you want to set the expectations with families. If you're just a general practice and you're just kind of getting into this work, set the expectation early that you're looking at more than just teeth, so you don't catch a family off guard of like, I came because I wanted my kids' teeth cleaned, and why are they talking to me about all this stuff? You want that to be part of everything. Your branding, your upfront, they know from the moment patients pick up the phone and call, they know what they're getting. You want to screen new patients. Again, if you don't have the practice yet where patients are coming to you specifically for these issues and you're kind of looking for them in just your own existing patient pool, use screening forms. Use the one I created. I created 2 for you, actually. Functional red flags guide too, that the hygienist can keep in their operatory and just go through and check boxes. And train your team that when you have your team meetings, make these topics of discussion so that everybody feels prepared to talk about it. So with that, we can kind of start the Q&A discussion. And just to remember that really the first 6 years are such a critical window. I hope you have taken that away as a pearl today, that it starts right away. Airway and tongue function and facial growth are all deeply connected to sleep, behavior, and systemic health, long-term systemic health. If you use a simple team-based screening process, you can catch these kids early before small problems become really big problems, and you don't need to do it alone. You can't do it alone. You have to refer and collaborate and build your interdisciplinary network. You have to, pick up the phone and call people in your community that are already doing this kind of work. If you don't know anybody, there are resources. So Airway Circle has a list of providers that might be in your area. AAPMD, Breathe Institute, there are lots of organizations out there that have provider resources lists that you can look at. And you want to identify a couple people, start small, like a couple, get a myofunctional therapist on your team, and the rest will go for there, because they will also know people as well, right? And you can just start to collaborate. You can co-treat. My myofunctional therapist comes to every one of my release appointments. So if we are treating a patient together, she is my surgical assistant. So I'm getting real-time feedback from my therapist as to how things are looking and feeling from her point of view. It's absolutely invaluable. It is a really cool way to learn and grow together. Again, building out your whole team, collaboration really does cure. And then these are the resources for you if you want to scan those QR codes. So the Breathe, Grow, Thrive screening form includes, that was the one I kind of ran through at the beginning. That's giving you both interview questions and clinical exam. And then the functional red flags checklist is more of just like a faster checklist. You can combine them, you can do whatever you want with them, but they're yours to use, and hopefully help treating and helping more kids in your practice.
This is incredible. Keep going.
Yeah, no, that's it.
That's
it. It's Q&A. It's Q&A. That's me. So this is me. This is how you can connect with me at Dr. This is my personal Instagram. This is my practice Instagram. This is my personal website. This is my practice website. So please reach out, connect. Let's learn together, and let's help these kids grow and thrive.
Yay. Please take a screenshot. So you guys do not forget to follow her on Instagram and get Dr. Ariana's info. This has been an incredible presentation. Perfect way for us to get back to our TNLs. Thank you so much for the resources. That is so valuable. We know how long it takes for us to put those together. And I really do believe that the most successful people in this field, and successful, I mean the ones reaching out and helping the most patients, are those who are so open about sharing what they're doing. So thank you so much for sharing with us your resources.
Happy to do it.
Thank you. I do have, please show the QR code again, if you can go back to the other screen. There you go. I know I have to log in into my Canva. I just changed my password and I can't. I'm going to take a screenshot so I can do it later. Actually, screenshot with my computer so I can use my phone to do it later. Very, very good. And then we're going to stop sharing the screen. So I have some questions. My first question is actually going to be a little bit more business related. There are so many pediatric, orthodontic, and general dental dentist practices out there who are so busy and so successful doing what they're doing. How, business-wise, because I'm a business owner too, can we convince or introduce the opportunity of treating airway patients in a practice? Because we know it's almost like you're going to take a step back because you're going to spend more time with these patients. You have to do more and not necessarily get the financial return in your investment. It's different. So do you have a recommendation? What would you say to a practice owner that is doing either ortho, pediatric, or general, that it's beneficial in some way to start screening patients for airway?
Oh yeah. I mean, that's such a great question. When I graduated dental school, so my father's a dentist, I joined him in practice, and that first year we bought another dental practice so that we could just grow the patient base so I could have patients to see. And it was a cosmetic practice. And I came in, and then like pretty much out of the gates, I was kind of doing airway stuff. And the dentist that sold the practice to us said, his parting words to us said, "Well, if you're going to look at the airway, you're not going to be doing much dentistry." That was his parting words. Like, best of luck, you're going to run my practice into the ground. And honestly, like, that's just lies, lies, and more lies. Okay, so here's the deal. First of all, you have to love it, and you really have to think about your workflow, right? So like, how have I made this actually like some both gratifying in both what I'm doing and also profitable and able to support my team and my life? Honestly, starting early helps, and building out my skill set. So it started with just my entrance into it was interceptive orthodontics, but then now it's the tongue tie stuff. And it was just adults, and then it was children and adults. And then it was, okay, nobody in my community is doing babies. Wow. Okay. So now I'm going to do babies and children and adults. And then you just keep, and then I was doing, actually at the beginning, I was also doing oral appliance therapy for sleep apnea. So I was trying to capture everybody at their different stages. That's kind of how we kind of built this out. And then I say to these people, like, if you stay with it for long enough and you truly love what you do, my practice, I don't do general. I mean, the guy was right. I don't do general anymore. Last year I stopped accepting general patients, and now my practice is really just interceptive ortho and tongue tie. However, we do have a functional dental practice because this stuff dovetails. I really think it's difficult to do this as a general practice if you don't also take that oral systemic approach. It's hard to talk about airway and all the reasons this is so important if you're still plugging amalgam and you don't really understand how like the airway is disrupting the oral microbiome and how that's then affecting their gum disease. Like it gets a little challenging. So, that's all right. You start one drop at a time. You keep building. It happens.
100%. And how is this related? So let's say as a dental practice, now I'm going to start looking at some airway, finding out that maybe vitamin D deficiency has to do with increased decay, mouth breathing, all of these extra things, and diet. Too much dairy can increase inflammation and mucus formation. How are these new findings related to all the dental stuff? Maybe instead of finding decay and treating the decay, how does this new knowledge will help a dental office implement airway and see their patients differently, treat their patients differently in terms of prognosis? What should they expect to see in these patients over time if they start looking at a little bit more?
I mean, I've always said like if your jam is general dentistry, like your general dentistry will absolutely benefit from looking at airway and these other kind of oral systemic things because your work will end up lasting longer. You know how many if you guys are on Instagram and you see all these beautiful cosmetic cases before and after, and if you look at it with an airway lens, they're like, oh my gosh.
Yes.
Good thing they took the picture on delivery because I guarantee in a couple of years, this patient is going to grind the heck out of that beautiful porcelain
Mhm.
work and it's all going to be coming off. Or you see how much they lengthened the incisors and you're like, wow, they've really locked this person in. That's a TMJ headache pattern waiting to
Yeah.
happen. I hope they know how to fix it, right? So it will actually help your general dentistry. And the other thing I will say is you don't know how hungry the general public is for this information until you start doing this work. Like we do not have a new patient flow problem.
Uh-huh.
I mean, we're now at the point where like it's months to get on the list to see us for these
Amazing.
kinds of things because guys, this is now the rule. It's not the exception. Like Renata, I don't know about you, but like it used to be like the occasional child that was in here with sensory integration issues and maybe autism spectrum or ADHD. And now it's like that's pretty much the kid.
Mhm.
And
Yes.
now the exception is like the child that doesn't have a neurosensory integration issue, right?
100%.
Yeah,
Both
and
of you.
parents are frustrated. You guys are not getting this information from their pediatricians. There's no way. The pediatrician does not have time. And they don't
Exactly.
don't have the desire, time, all of it. Like you are it. You are often going to be a
Mhm.
lifeline for these parents, and parents talk. Those moms group on Facebooks are powerful, powerful marketing tools and networking things. And your name starts to float around as somebody who's interested in this, who cares, who knows about it, who can get you to the right people, and your practice will explode.
Oh, I love this. 100%. Another business question. I don't know why I have all these in my mind right now. But how did you start making the switch? How did you start speaking to patients about this? You mentioned making sure that every aspect of your practice, so the patient already knows, already expects, from the second that you answer the phone, the second that they walk into the office. How did you start making the switch, and how would you recommend for other professionals? Where should they start? Is there a
Oh,
program that you teach how to
Um,
implement?
I don't teach yet. I'm working
Yet?
on that. But so you mean like where do they get the education or like literally from like a business systems point of view, how do you start that?
Business point of view, how do you start?
Yeah.
What did you start changing first? Was it
Okay. So the first
training
thing
the girls on the phone? Was it putting posters in your
that's such a great question. So actually, honestly, the easiest thing to do is change your health history. Start there.
mhm,
Start putting the questions on your health history. That's the first piece of communication your new patient is going to receive from you, like their first paper
mhm.
communication is them filling out their health history. There should be lots of airway questions on your health history because now they've already been like, why are they asking me what time I go to sleep and wake up? And why are they asking me how many times a night I get up? And why are they asking me whether I snore and have I had a sleep study and do I wear a CPAP and do I tolerate it? So that's one easy place to start that doesn't require a whole lot of effort. And then we changed the name of our practice
Ah, I
from
love it.
Ebrahimian Aesthetic Dentistry to Ebrahimian Integrative Dentistry. And that really just captured what we were passionate about and what we wanted to do. It does not say Ebrahimian General Dentistry. It does not, it does not say Ebrahimian Dental Group. It doesn't say Scotts Valley Dental Care. No, it says Ebrahimian Integrative Dentistry. And and all of our marketing then was kind of geared towards that. So that's where we
I
started.
love it. I love it. And did you have any pushback at all from the patients?
Um, my dad had started like his neuromuscular journey. He was kind of doing things differently before
Mm-hmm.
I joined. So patients um had already been coached through one big change in the practice, right? The occlusal philosophy changed, and that was a big shift. And now we were talking about things that he had never been talking about before. So patients who are just looking for their cleaning went elsewhere and found a different dentist, and then the rest stayed. And then they kind of just got used to like things are always evolving in our practice.
Yes.
That's the type of practice we are. So our patients who come to us know that like we may be talking about something else next month. Like that's okay.
Yeah.
And the ones that you lose is a good thing. They don't belong in your practice. Like that's not actually the patient you want to be in relationship with. They're not really interested in what you have to say. They're probably
Yeah.
not going to make the changes that you would hope that they make to be healthier and better. So yeah, Don't
Amazing.
patients that leave your practice when you make these changes. Those are not the patients that give you a fulfilling career.
Amazing. Shiraz is asking, this is a great extensive introduction that needs to be seen again and then followed up with more education. So please, you guys, if you're not an Airway Circle member, please join us. We do these. You know what? I totally forgot to get out of Facebook. I'm not sure if I showed the whole thing on Facebook. I don't think I did, just the beginning. But please invite your colleagues. If you have other dentists, if you have a study club, Airway Circle can actually help you put together a study club. We'll send you resources. You guys, get the community together. We do everything that we can online to help everyone. However, we know how important it is to build your local community to be able to help your local patients. So if you start a group, just let Airway Circle know. We send a video, we send a discount code, we send a couple gifts, we send snacks and things for you guys to be able to do these. Whatever we can do, the little bit that we can do to help our members. And then share the directory, share the Thursday night lives with your friends. If you know a dentist and orthodontist around you that you'd like to start working with, but they're not 100% sure they want to get into this, say, listen, there is this talk coming up next week and it's free to join live. It's Thursday at 8 p.m. Eastern Standard Time. And here's the link. Please join. It's easy to register for those. But Shiraz is asking, do you have any resource recommendations, please? Do you want to elaborate on that? What other resource recommendations? Let us know. So we have the Thursday Night Lives. We actually have an intro course for anybody who wants to get into this. It's mainly dentists that take it. It's called Intro to Airway. I actually have this hidden. I don't have it promoted anywhere. So whenever I see somebody that's interested in just getting their feet wet, Intro to Airway, I think there's like 14 speakers, and they are some of the best speakers in the world. On sleep, we have Dr. Steve Carstensen, Dr. Gerald Simmons. We have a physical therapist talking about the relationship to airway. We have Nicole Goldfarb. My goodness, there's so many amazing names talking about myofunctional therapy and sleep, talking about the muscles, how they relate to everything else. We have a breastfeeding talk. We have oral habits talk. So it's literally like the basics of everything. If you want to get your feet wet, it's called Intro to Airway. Private message me, text me, however you can find me on social media, and I'll send you the link for that course. All of our Airway Circle courses, whenever you join, you have forever access to all of them. We also have myofunctional therapy courses that goes a little bit deeper. Foundations is our intro, which is not really intro because it's extremely comprehensive, starts August 1st. And then we have an advanced course we're going to teach next year. However, there's tons of resources out there. The Airway Circle membership, www.airwaycircle.com. You'll find all the information on all the resources that Airway Circle has over there for you. And the last thing, I mean, we have podcasts, we have YouTube channel, you name it. We try to be everywhere. So somebody, whatever you like, we're going to have a resource for you. Any courses for CSTs, craniosacral therapists? Yes, the Intro to Airway will be a great one for you. For our myofunctional therapy courses, they are more like if you'd like to practice or a dentist that works with myofunctional therapy that wants to understand a little bit more. So it's dental hygienists, speech pathologists, dentists that can take that course. And we just recently opened to OTs and PTs. But you have to have one of those degrees and licenses. And then the Airway Circle membership is for everybody. We have over 200 lectures already recorded, just like this one that you watched. They're incredible lecturers, incredible professionals that take the time to come over here and share their expertise with us. And like that, all of us together can improve the world of airway by encouraging other providers to get their feet wet and, planting seeds everywhere and really helping patients find you. That's why we started the directory. We have over 3,000 visits to the directory every month. So some of you are getting referrals from us and you don't even know it's coming from us because we're literally not checking to see how many clicks you have. And we don't take any money from that at all. All we ask is for you guys to help us share Airway Circle word, share about the membership, share the Thursday Night Lives. We just want more and more people to hear about this. So thank you guys. This has been a wonderful talk. Any last few words you would like to share with the public?
I'm just so excited that I feel like when I started this journey, I really felt like I was on an island and there weren't very many of us. And to just see the explosion over the coming up on 20 years and a couple years here for me, explosion of this, and to come so much into the mainstream consciousness is just so exciting. And I am so thrilled that there are so many of us out there that are passionate about this work and helping kids live better lives.
100%. Yes, it's just somebody said, I wish I could start my dental career over again. Shiraz, send me a message and let's talk on the private over here. But thank you guys so much for being here. We love you. We appreciate you, Dr. Ariana. You are absolutely wonderful. Your work is saving so many lives. So thank you for putting all this information, this knowledge out there and helping so many kids. Please make sure that you are in our directory. Patients are going to be flying over to you.
Thank you so much. Be well.
Thank you.